Hi everyone. Today we will be discussing the fifth basics class on ECG, and we will be discussing about a normal P wave morphology. Okay. So as everyone knows from this picture, it is very clear that the initial positive deflection in an ECG is called a P wave. Okay. And all of you know very clearly that, and it is as a result of this P wave is as a result of the depolarization of the atrium. We know that there is a right atrium as well as the left atrium, and the depolarization of the atrium happens in from right to left. Okay, that is the repolarization begin in the right atrium, and then it moves to the left atrium, followed by that. Okay, so in this picture you can see this is the P wave, this is the P wave, enlarged P wave, and here you can see that here there is a brownish area that represents brownish triangle that represents the depolarization of the right atrium, and there is a violet area that represents the depolarization of the left atrium. Okay, and we can actually divide this P wave into three parts. There is a initial 1/3, middle 1/3, and the final 1/3. Okay, so that we can, from this picture it is very clear that the initial 1/3 is contributed by the right atrium alone, and the final 1/3 is contributed by the left atrium alone, while the middle 1/3 is contributed by both right and left atrium. Okay, that is the contribution of the right and left atrium togetherly makes the P wave. Clear? Okay. Then we should know what are the basic measurements associated with the P wave. The P wave normal duration is less than 120 millisecond. Okay, assume that this is your P wave. So this is the P wave duration. So it is less than 120 mean it corresponds to 3 small boxes. Okay, then comes to the amplitude. Okay, the amplitude actually varies. So the amplitude in limb leads corresponds to, normally it is less than 2.5 millimeter. That is, it consists of nearly, the height corresponds to less than 2.5 boxes. Okay, while in the chest leads like V1 to V6, the amplitude is less than 1.5 millimeter. That is, here the amplitude in chest leads is less than 1.5 box, less than 1.5 box. Okay, as we should know the vector related to the P wave. Okay, so we should know that in most of the leads the P wave is positive. That is, in the leads like lead 1, 2, V5 and V6 and all, in all these leads the P wave is positive. Okay, while in the lead AVR the P wave is negative, and the P wave is biphasic in lead V1 and sometimes in lead V3. So we will come to know how it happens. Okay, so we will be discussing in that. Okay, so in most of the leads we have told that we have told that it is positive. The reason is that the P wave depolarizes, in the direction of depolarization of the P wave is inferiorly and towards the left side, especially in leads like leads 1, 2, V5 and V6. In all these leads it depolarizes inferiorly and towards left side. That is, they depolarizes in the same direction. Okay, so that they have a positive wave. And also in these leads both the right atrium and left atrium depolarize in the same direction. Okay, so that this will be the repolarization of the right atrium, then there will be depolarization of left atrium, so that they have a positive wave. Okay, but in the case of AVR, the problem is that the AVR vector is directed opposite to the direction of depolarization. Okay, we know that in the Eidovens triangle, while we are drawing, we are directing the AVR in the opposite direction to the depolarization. So that is the reason in AVR the P wave is inverted or it is negative. Okay, so if in lead 2 it is positive, while in AVR the P wave is inverted. That is normal in AVR. While coming to the V1, in V1 the problem is that in V1 the right atrium and left atrium depolarizes in the opposite direction. Okay, so assume if it is a repolarization of the right atrium, then this is the repolation of the left atrium. Okay, so that in lead V1, so there is a positive deflection and a negative deflection. The positive deflection represents the right atrial repolarization and the negative reflection represents the left atrial depolarization. So this is the reason why the vector changes in different leads. So we will come to the example. So consider this is the lead 2. Okay, in lead 2 there is initially depolarization of the right atrium followed by the left atrium, so that it produces a positive deflection. Okay, then coming to the lead V1. In lead V1, initially there is the depolarization of right atrium, then there is the repolarization of the left atrium in the opposite direction, producing a biphasic P wave in lead V1. While in the case of lead AVR, even though both right and left atrium depolarize in the same direction, it is opposite to the depolarization, so that it will produce a negative deflection or an inverted P wave. Okay, so this is the basic thing about P wave. Even though it looks simple, it's very important to understand various pathology related to the P wave. So in the next class we will be discussing about the abnormal P wave. Hope it is very clear. Thank you for the patient listening. Please subscribe the channel to get the updates.